Hey, it's Chardá at Melanin Milk, and I'm here to give you 5 tips on how to have an easier birth. So many people have all these horror stories, and you see all these horror stories on YouTube, on Instagram, on TikTok, on Twitter, and I'm not here for it. I'm here for the positive birthing experiences. I'm here to turn those negatives into a positive and help you and teach you and educate you on childbirth so that you can be more empowered in your birthing experience, so that you can make the choices that are best for you and your family, and so that you can create a birthing experience that you'll love and help you hopefully find some ways to make your birth a little bit easier. I got you, boo. Number 1, spinning baby. I highly recommend you check out the free resources available at Spinning Babies. I'm gonna drop the link in the bottom of this video, but when I work with a new client, I love to start them with the 3 balances, or they call them the 3 sisters, at any prenatal appointment that I go to. And then of course, when we start laboring, before we start doing position changes and before we get into the real movement work, the 3 principles of spinning babies are balance, gravity, and movement. It's a simple concept that says adding balance to the body will allow gravity and movement to help your birth. I'm not talking about spinning a baby. You're probably thinking I'm talking about actually coming in and spinning your baby, right? That's what it sounds like when we say that. You're probably also wondering where I just came up with this random pelvis, but I have all kinds of little knickknacks lying around. If you stay around my channel, you'll find some interesting things popping up. But if you have not heard of spinning babies, I don't know what to tell you. I don't know where you've been. I don't know if you've been under a rock. I don't know if you're a real doula. You know what I'm saying? You are missing out. Period. You are pregnant, if you're expecting, if you have a doula that is not familiar with spinning babies, ask them to become familiar with spinning babies. If you are a doula and you're not familiar with spinning babies, become familiar with spinning babies. And resource that I use that's free, available to my clients, and it really works. Breathing. Anytime a client comes to me and says, I want to learn how to breathe while I'm in labor, I want to know how to breathe when I'm in birth. You know how to breathe. It's about learning to use your breath to work with your baby. Working with your breath to bring your baby down is one of the most beneficial practices that I teach people when I'm working with them prenatally. It helps them to visualize their baby actually going down and coming out the birth canal. We can practice this as early on in the pregnancy as we like. He is becoming so used to it that when it's time for you to labor, that breathing pattern becomes second nature to you, and it then helps you to get into your zone more quickly and more easily, and it helps you to be able to get through that. 3, childbirth. People really take this for granted. I don't know if I would have been able to go through birth without a doula if I had not taken a childbirth education course. I took a childbirth education course with my first child, and it was super helpful to me birthing in the hospital. I didn't know what to expect, but taking that class really prepared me and helped me to understand what was going to happen with my body, so that when things were happening, I was more comfortable with what was happening. And so I often say, you know, if you're a first-time parent, or if you're even a parent that has had children before but you've been out of that childbearing game for a little while, then go ahead and take a quick refresher class or take a childbirth education course. They're often, if you're birthing at a hospital, a childbirth education course can often be offered at your hospital where you'll be birthing at. If not, you can look around, ask a friend, ask a doula, look on Instagram, look on social media, you know, and go to birth centers. It's a really good place to find a childbirth education class. It's super helpful to know what your doctor or your midwife is talking about when they're referring to things like effacement or station, like station meaning where is my baby? Is my baby really low, or is my baby really high? And so having an understanding of where your baby is in your body and having an understanding of how your body is working with your baby to bring your baby down and out is super beneficial to having an easier birth, just from knowing, just from having power. There's power in knowing. Knowledge is power. What terminology your doctor is talking, you don't have an understanding of that. Very common medical terminology that they throw around, but that often, you know, it gets tossed around in the room and then it goes unexplained in labor. And so you're just like, what does that mean? What's happening? And it can be really scary. And when things are scary, it causes your body to tense up. And when your body tenses up, you can't let the baby out. So if you want to know something, hire a doula. Doulas know a lot. Or body balancing. This is something that we don't talk about enough during pregnancy and with our clients, is just going to the chiropractor when you're complaining of that low back pain, you're complaining of trouble sleeping, you're struggling through that last leg of the pregnancy. What can you do? Maybe it's your baby's positioning that's a little bit off and causing you some of that pain or discomfort. And so going to a prenatal chiropractic visit, getting a prenatal adjustment, man, that can be life-changing. I mean, I have seen wonders be worked with regards to women or birthing people that are pregnant and are struggling in their own body because they're like, I just feel awful. Everything hurts, everything is bothering me. And then I say, well, why don't you go get some body work done? Why don't you go get some body work done? Why don't you go get a massage? Or why don't you go to the chiropractor and go to the acupuncturist and tell me how you feel after that? And if you don't feel good, you know, we'll try some other things, but let's start there. And so, and we often hear a lot of midwives say, you know, if the baby's position in utero is a little funky or a little off, then that could be the cause of some of your back and back problems and your sleeping problems. But also that is what's going to stall your labor or cause you to have more difficulties throughout the early labor or the late labor phase. And you know, we don't want that. And going to a prenatal adjustment can be super beneficial to not just your pregnancy, but also to your delivery, for your birth. Make sure that you find a chiropractor that specializes in the Webster technique, which is specific for pregnant people. If your chiropractor is not comfortable with or is not familiar with working with pregnant bodies, please find someone that is. I can't stress that enough. So I say body work is important, but also finding someone who is aware of pregnant bodies and how they work and how we need to treat them is the best way to go about that. And so it can be super helpful in resolving some pains and things that you may be dealing with, and it will open your hips and lengthen your spine, helping you to have more space for the baby and creating optimal fetal positioning for the baby while they're in utero and helping them pass through that birth canal. Negative therapy. Past trauma can definitely affect the way that you labor and the way that you give birth. Talking through some of your anxieties, whether they're birth related or not, can really help you to have a more empowering birth experience. And going to therapy can open your heart, your mind, your soul, allowing you to breathe easier and process and move forward throughout your pregnancy and throughout your birth, and to keep going when things get tough. Therapy can also help you with pain management and coping skills individual to your specific needs. One of the exercises that I learned from my therapist that I like to do with my clients prenatally or sometimes in early labor, just take an object. So I just grabbed this random object. It's the mallet to my singing bowl. I'm gonna close my eyes, and what I would do for my client and what I would ask you to do is to just grab whatever's around. You know, it can be the remote control, it can be a mallet from your singing bowl, it can be you know, a scarf that you have. Like, we're gonna put it in the hand, we're gonna close the eyes, and we're just gonna feel what this object feels like. What is that object? How does it feel? How does it feel in the hand? Is it hot? Is it cold? Does it have a temperature? Is it hard or is it soft? This has ridges on it. It's wood here, and it's kind of like a felt feeling here. Before I placed it in my hand, I knew what the color was. It's black and brown. If I had not known what the color was, some things I might want to think about are, what color is the object that I'm holding in my hand? Maybe I can imagine that. And so doing things like this will really help to ground you. It's a grounding exercise and a grounding technique that a lot of therapists like to use with their clients. And I like to use it with my clients as well, even though I'm not a therapist. I do like to use it with my clients that are struggling with any type of trauma or adverse childhood experiences that may come up during their birth. Past sexual trauma or something that would prevent you from being able to get cervical checks, or that would prevent or hinder you from being able to be fully open during your birthing experience. That's something that we want to be mindful of in the way that our body works with our baby to get our baby out. If we are tense, if we are afraid, if we are concerned, if we are scared, our bodies react and respond to that, and in protection of the baby, that response can protect the baby or it can eject the baby. And so, you know, we want to make sure that we are always keeping our bodies moving and open, and our hearts and our minds and our souls open. In addition, because the physical body is not the only part of childbirth. It's very mental, it's very emotional, and it's very, you know, taxing on the mind. And so therapy can make a huge difference if you go into your birth having done some form of therapy or some level of therapy. You will see tremendous benefits, and not just the outcome of your birth and your birth experience and your birth outcome, but as well as your postpartum phase. And I highly encourage you to stay involved in therapy in the postpartum phase when things get a little bit harder. And so highly recommend therapy before you have a baby in order to have an easier birth. So those are my 5 tips on how to have an easier birth. I hope you enjoyed them. Take what you want and leave the rest. And I hope to see you on my next video. Bye. I hope you enjoyed learning these tips, and if you did, go ahead and like, comment, subscribe, hit the bell if you want to get more videos from me, and I hope to see you on my next video. Until then, happy birthing!